found in mandible than maxilla, which may arise for the reason that there is a later development of upper third molar and more unilateral than bilateral. Next, about etiology. The impacted second molar is an asymptomatic pathology. The main thing it's about from failure in mechanism of the eruption, supernumerary and odontogenic tumors or cysts can be the major physical barrier of the eruption path. Heredity is also brought up as a secondary etiology factor. Next, about diagnostic approach and treatment time. The best time to treat the patient which showing with second molar impaction in our clinic, it's better to start about like 10 to 13 years old. At that age, we can see the patient have mixed dentition between male tooth and also permanent tooth as well. So it's very good to start at that time according to the age as well. And also they still in growth, still have growth at that time. So we can stimulate for tooth eruption, or even we try to just upright more predictable result. Rapid diagnosis is crucial in improving prognosis. A panoramic radiograph showing a lower third molar follicle position on top of the developing second molar crown may give early warning of future impaction. So we can see the patient in our clinic and we can tell the parents from this age as well, because some patients just come to dental clinic just for check-up. The main thing that very important is about, dentists to be aware and concerned about try to send patient to do X-ray for some reason, such as could not see second molar in proper age. Normally, we can see second molar erupt in oral cavity. It's about like 12 years old. If at that age we could not see this tooth eruption, we better to send the patient to do X-ray and talk to parents about the treatment plan for that. So I think if we can start at early, it's better than late. Early better than late for sure to start, and even from for diagnosis, treatment plan, and also treatment. Quick, early, it's better. The treatment option depends on degree of mesial angulation, inclination of impacted teeth, vertical depth of impacted teeth. For treatment modality, the first thing that our dentists, even orthodontists have to do is observation. Of course, for some family bring their kids to see dentists just for the dental checkup. They have no plan to start orthodontic treatment yet, or they just want to see the dentist and just talk to dentist and make consultation about what's going on for that age, and have any cavities or not, or they need to start orthodontic treatment at that age already or not. For example, if we see the patient at this age, it's very good time to do oral examination, discuss with the parents. If we saw second molar impaction at this age, it's very good time to just tell parents that we have to hurry to fix this problem For example, for this age, it's very good time to start orthodontic treatment. If we saw this problem about like 10 to 14 years old boy or girls come to dental clinic, it's good to tell the parents that, okay, it's time to start orthodontic treatment already, and just send them to check by X-ray to make sure that we possible to do uprighting for that second molar impaction or not. So we have to manage space for do uprighting as well, to make sure that we have enough space to move the teeth to the right place that we want to. Okay. And next one is surgical exposure. So I will talk again about how many ways to do. This is a conventional appliance for orthodontic treatment. If we found that the patient have second molar impaction at age about like 10 to 14, we may just, oh, sorry. We may start orthodontic treatment using conventional appliance. We may use wire, even wire bending to upright the second molar impaction to get a proper position, because proper position is good for patient, at least for cleaning, for using for eating. Even eating is very important, right? Or the people have to eat and to get good quality of life from eating. So if they have the perfect position of the molar area, so they can eat, they can function, they can have they have good occlusion, is very good for them for quality of life as well. This is another technique to do for orthodontic treatment. It's called orthodontic uprighting. We can design some spring or orthodontic wire to combine with temporary anchorage device, or we call mini screw here, right here, to upright second molar impaction, or even any molar impaction. We can use this technique as well. For the next one, I will talk about surgical approach. Surgical approach, we have several ways to do, several techniques to do. The first thing is about surgical exposure and luxation. And next, we just do surgical uprighting. Actually, we can not do surgical approach alone with our orthodontist. So oral surgeon have to do surgical exposure and luxation and also uprighting here, and have to refer to orthodontist to apply bracket later to get the perfect position using orthodontic treatment. For next, about another way for surgical approach is extraction. We will perform extraction in the case that have poor prognosis, such as have large dental caries that cannot do root canal treatment, so we have to remove it. But for this way, I mean, for extraction, it's not, actually it's the most unsuccessful modality, because in the past, when we remove second molar with young patients, such as like 12 or 13, and we're waiting for third molar to erupt, the age of third molar will erupt about 16, 17, 18, something like that. Okay, about at that age, starting from 16. So we just remove second molar at age 12 or 13 and waiting for third molar for 2 years, because we think the third molar will come up at right position as we predict. But actually the third molar never be that place that we want. So it's always misposition state. So I think the plan for the patient, extraction is not good plan. So, but sometimes we have no choice. Dentists or orthodontists have no choice. We have to do extraction, this one, because we cannot do some restorative after that. Next is auto transplantation. For second molar, which is have some problems such as like large dental caries or large cavities. So we cannot fix the problem such as like root canal treatment, or we cannot do any treatment. So we have to remove it. Another plan, if the patient still have third molar, it's auto transplantation. So we will remove the second molar out from here, and we just replace with third molar right here. So this is the X-ray to show about 3-year follow-up and 12-year follow-up. It's quite good, and patients still have good function for using third molar replace second molar. For conclusion, early diagnosis and early treatment are crucial for the successful treatment of mandibular second molar impaction. Age consideration is important. So I recommend the good age to the best age, I may say that, to start alternative treatment, and also for start the treatment who have a second molar impaction is about 10 to 14 years old. At the end, I want to thanks my dean and colleague at Walailak University International College of Dentistry, Bangkok, Thailand, and thank Dr. Ann Chientitler, postgrad student in the program of master degree program in orthodontics. She is my student, and she helped me to prepare some information for this presentation today. Thank you.